This is the last part of 2002 paper. Okay, we will first is that is question number 36 is fluocinolone is an antifungal drug that is a steroid drug. Not antifungal, steroid. B, vitamin E is considered as a water-soluble vitamin. There are two kinds of vitamins. One is water-soluble type, other one is fat-soluble, not water-soluble. So, fat-soluble vitamins are vitamin A, D, E, and K.
Rest.
Okay. Now, see, this is the picture. This shows what are the vitamins, water soluble, and what are the vitamins that are fat soluble. Fat soluble vitamins are, sometimes they ask in this name, you know, it's calciferol, tocopherol. Tocopherol is vitamin E, vitamin D is calciferol, and retinoids are or retinols are vitamin A, and vitamin B1 is thiamine, B2 is riboflavin, B3 niacin, pantothenic acid is 5, pyridoxine, and biotin. These are all water soluble vitamins. Ranitidine gives rise to drug interactions with a large number of commonly used drugs. That is true. Ranitidine has interactions with a huge lot of drugs. Interaction means the metabolism of those drugs are sometimes inhibited, sometimes enhanced. So the second drug is affected by using ranitidine with that drug together. D. Heparin promotes clotting of blood. Now, heparin is an anticoagulant. It inhibits blood clotting. Heparin, the action of heparin, it is here, I think. Yeah. No need to go in the blood. Now, in the blood, usually protein mechanism work. In the protein mechanism, you will see prothrombin is converted to thrombin. This thrombin forms fibrinogen to fibrin. Prothrombin, this is when you see the mechanism, this is some complex here. After so many reactions, finally, prothrombin turns to thrombin. Thrombin changes, fibrinogen is soluble to fibrin, it is threads. Insoluble fibrin. So, under normal situation, this change, prothrombin change into thrombin is blocked by an enzyme. Here, this reaction is blocked by antithrombin AT3, antithrombin 3. Antithrombin 3 prevents change in prothrombin to thrombin. Heparin, what does it mean? This antithrombin action is increased by 1,000 times by heparin. So blood never clots because antithrombin action is now very fast because of heparin. That is what here also. This is not that clear. Increased rate of reaction by 1,000-fold. That is action of antithrombin 3 is increased. You have to know that. Chlorpromazine is used to manage schizophrenia. That is true. Schizophrenia is, they are very violent, difficult to control in schizophrenia. Lack of motivation, they have trouble of thinking. Anticholinergic side effects are seen with the following drugs. Anticholinergic effect means dry mouth, secretions are reduced, dry eyes, and slow movement. Promethazine, true. Promethazine make dry mouth because it is anti-allergics. B. Amitriptyline, true. Almost all antipsychotic drugs have also anticholinergic action. Terbutaline, no. Terbutaline is given in asthma. That is a short-acting beta-2 agonist. Benzexol, true. Benzexol is given in Parkinson's disease. This is the side effects of benzexol. Hypnotropium bromide, true. Hypnotropium bromide is anticholinergic drug. It is administered as only as inhalation. It does not absorb to the body. Given for asthma. See, this is like atropine, some modified way of atropine molecule. Question 38. True or false, the combined oral contraceptive pill is recommended to be started on first day of menstruation. That is false. Actually, it works from 7th day of menstruation. The combined oral contraceptive pill reduces the amount of breast milk. It is true. Estrogen and progestin, they reduce the production of milk. The combined oral contraceptive pill is known to dissolve blood clots in blood vessels. That is false because it forms blood. One side effect of oral contraceptive pill is formation of blood clots on blood vessels. The estrogen in the pill may cause formation of blood clots more easily. That is, it cause deep vein thrombosis, that is clots in the leg, pulmonary embolism, that is again clot in the lungs, stroke, heart attack. Dipomedroxyprogesterone dipomedroxyprogesterone, Depo-Provera, use karane once in 3 months, every month. Answer is false. No plant is an oral contraceptive. No plant කියලා කියන්නේ මේ මසල් එකට පොඩි සූරයක් වගේ තමයි. No plant is not an oral contraceptive. It is a device placed under the skin. This no plant has 6 capsules, 36 milligram of progestin, levonorgestrel. Total dose is 216 milligram. Slow release. Right. Question number 39. True or false? He promotes absorption of iron from bowel. That is false. Everybody knows that you have take. You can't take tea or coffee with iron. It reduces iron absorption. B. Vitamin D is inactivated by exposure to sunlight. So vitamin D is synthesized in the body when you have sunlight. Vitamin D synthesized කරන්නේ sunlight වලට expose වුණාම body එකේ. Now we will see how vitamin D is synthesized. Starting material is cholesterol. From cholesterol, when exposed to sunlight in the skin, it produces vitamin D3. That is vitamin D3. Vitamin D3 is converted to 25 hydroxy vitamin D by the liver. So skin is involved. After that, the liver. हमें හැදිලා ඊළඟට හැදෙන vitamin D3 liver එකට කියලා liver එකෙන් 25 hydroxy vitamin D හැදෙනවා. Then in the kidney 25 hydroxy vitamin D is converted to 125 hydroxy vitamin D. So first the position 1 is hydroxylated, then position 25 hydroxylated, then position 1 is hydroxylated. This is the active vitamin P. That is 125 dihydroxy vitamin D is the active form of vitamin D. So the target organs are seminal fluid, sperms, and placenta. then uterus, endometrium, ovary. This is in the reproduction, the effect of reproduction from vitamin D. C. Albendazole is contraindicated during pregnancy. That is true because albendazole, not like mebendazole, albendazole absorbs to the body. Mebendazole does not absorb into the body, but albendazole absorbed into the body. So we are not giving albendazole during pregnancy. First time is contraindicated and should avoid within first 1 month before the pregnancy. The mebendazole is ineffective against roundworm infection. That is false. Mebendazole is a broad spectrum anti-helminth drug. So it works for almost all worms in the intestinal tract. Metronidazole has no activity against anaerobic organisms. That is false. Metronidazole is again active against protozoa. That is amoeba, Amoeba histolytica, that is amoebiasis, Giardia lamblia, then Trichomonas vaginalis. All these protozoal parasites are killed by metronidazole. And also, the other one is anaerobic bacteria. Now, bacteria has two kinds of bacteria, actually 3 kinds. One is aerobic, they need oxygen to grow. Then another group of bacteria, they are called strict anaerobes. They cannot grow in presence of oxygen. They are anaerobes. Now, facultative anaerobes are the anaerobes that they can grow in anaerobic condition without oxygen, or they also can grow in presence of oxygen. So whatever they have, they accept. So metronidazole is effective against anaerobic bacteria, not aerobic bacteria. So answer is false. Question number 40, true or false? Fluconazole is a tropical steroid. Fluconazole is a tropical steroid. Tropical means you can only apply on the skin. That is false. It is an antifungal. It's an antifungal drug. Then B, gentamicin belongs to the amino glycoside class of drugs. Yeah. That is true. Aminoglycoside class of drugs include gentamicin, then streptomycin, and topромycin. Gentamicin, topромycin, streptomycin. They cannot give orally because you can see a huge molecule. It is a huge molecule. And also it can ionize, so it cannot go through the absorption process in the stomach. So it can be given by injection. Now, topромycin is actually a eye preparation. ophthalmic preparation. So they are glycosides because it has here sugar molecule. This is a sugar skeleton. Glycoside means it has a sugar skeleton. Side effects of glycoside, gentamicin. Gentamicin is an injection, only injection form is there. It damages the eighth cranial nerve. So hearing, it affects hearing. And also it affects the kidney. Kidney damages kidney. So when somebody takes gentamicin or netilmicin or streptomycin is not that bad. Gentamicin especially, they have to check the kidney function. While taking the antibiotic, they have to check the kidney function, and also they have to check the blood drug level in the blood. It causes paralysis of skeletal muscle, gentamicin. Part C, gentamicin is given by the oral route to treat urinary tract infection. That is false because you can't give gentamicin orally. The reason is here, aminoglycosides are highly ionized and water-soluble drugs, therefore very poor absorption through the oral route. Only parenteral and topical applications are used. The anaphylactic shock is a rare side effect of benzathine penicillin. That is true. It is not very frequent, but it is fatal. The patient can die, but it is a rare side effect. Because if it is a common side effect, benzathine penicillin will not be given to patients. Fluticasone is available as an inhalation. True. Fluticasone is available as an inhalation.